Today I'm with Henrique Dias, founder and CEO of NoHarm, a nonprofit startup that develops AI-based tools to improve patient safety in Brazil's public healthcare system. NoHarm has received awards and project grants from Google, the Bill and Melinda Gates Foundation, and a number of other organizations. What they've done is really innovative, and I think you'll be very interested. Henrique, thank you so much for joining me. I am really eager to hear about NoHarm.
Yeah, thank you so much, Jane, to got interesting about us, and I'm glad to answer your questions.
Great. I think maybe the first question is a pretty practical one, which is very simply, can you tell me how it works? Not in detail, but in general, how the whole thing works. It's a little hard for me to imagine.
Yeah, No Harm, it's a non-profit organization here in Brazil. So this is our start. And we develop AI systems to improve the overall quality of healthcare system in Brazil, mainly in the hospital. And how we do that? We deploy systems in the hospitals and the primary care facilities that is going to evaluate all the information of the patients, like exams, prescriptions, clinical notes, laboratory results. And our system is going to assess all this information regarding the patient disease and the patient condition, and is going to highlight to the healthcare professional if there is any misleading or inconsistency about the patient drug treatment or some suggestion of exams that should be done. Some of this information are crossed by the information of the patient using literature. So it's not like an AI that's going to understand magically something. It's things that come from literature, because the reference exams, the maximum dosage of a drug, is things that come from industry. It's things that was defined by literature. So this is not AI. It's just crossing information. So this is what we do, and this is what we deliver for the healthcare in Brazil.
Well, that's very, very interesting. I had this sort of vague notion that it was sort of AI, but I mean, I know that AI is not what people really think it is. And very often it's a question of information that's collected and analyzed.
Yes.
And it sounds to me like that's what you're talking about.
Yeah, because sometimes people think AI is something magic that's going to
Yeah.
understand about the world so fast and better than humans. But there is some things that we need to be based on literature. And in health, this is very important. We keep that in mind.
What inspired this idea? Because this is my podcast is about imagination, and I wondered if you had some sort of if you imagined something that then you were able to build.
Yeah, so you can hear in other stories about the startups that people really build a successful startup after fail several times. So
Yeah.
before No Harm, I already had created another startups that failed. And so I began in my PhD scholarship. And during my PhD, my sister, Anna, she's a clinical pharmacist, and she evaluated every day all the patients about the drug treatment, about laboratory exams, reading clinical notes. And during my PhD, I was studying about AI and natural language processing. And I wondered, well, I think I can help you in your problem. So maybe we can start doing a research project inside a hospital and see what we can do. So this was the seed of our idea come from. Is from Annelena's problem that she faced in hospital, and my PhD that the ideas of how to automatize that comes from. So it's basically when we are chatting in a lunch in our family, when we're gathering everyone, we come up with some ideas of how to improve Annalena's job, daily life.
You know what I think is really interesting about that is you started with something very practical and you created something that's obviously recognized around the world as being amazing.
Yeah, it comes from that, from a practical problem. So usually the guys from IT, they imagine a solution without a problem, and then they get passionate about the solution. And here we got passionate about the problem. Lena's problem. So when you got passionate about the problematic of some job or the healthcare industry, you need to really carefully think about the solution and not build a solution for something that you imagine there is a problem.
So, how would you describe the people who use your solution? Are they medical personnel? Are they patients themselves?
Everyone that use our solution are healthcare professional. Most of them, like 90% of them, are clinical pharmacists. Clinical pharmacists is specialization of the pharmaceutical or chemistry people that is going to work mainly to evaluate the drug treatment and the drug adherence of a treatment that the physician assess to a patient. So this is the one that use our tool. So our tool is not like for dummies, should I say. It's for someone that is very specialized. There is the clinical pharmacist, someone that made pharmacy or chemistry in the graduation and as undergraduation, and in the graduation they made a specialization like clinical pharmacist for hospital. So it's someone with very good understanding about health.
How does it work financially?
We have like a mixed business model. So as a non-profit, we believe that we should have a good impact in Brazil mainly. So as a non-profit, we gave our system for free for the public health system, for the public hospital and public primary care facilities. But where the money come from? So in the beginning of our journey, we have to some money to start, but then we start charging our as a monthly fee for the private hospitals. So this is where our money come from, mainly from private hospital. You can see in my screen that we have other supporters like Bill and Melinda Gates Foundation. We have Google, Amazon that gave us credits for cloud computing, but our mainly income comes from the private sector. As a Robin Hood tech, we give our solution for free for the public ones.
Well, that sounds like a very smart way of doing it.
Yeah.
And is that working well?
Yes, it's working very well. And this is where our most imaginative ideas come from. So it's very unique startup in Brazil and very unique startup in the world that is a non-profit startup. And this comes because our family are mainly public employee in Brazil. And we have public school, public university. So we wonder how we can give back. We are not a wealthy and rich family, but even so, we wonder how we can give back everything that we have gained for free by the government. So this is the idea come from. So we build a non-profit organization to ensure that even after we pass away, our purpose keep going. Because as a non-profit, you are not able to sell the company, you are not able to sell the patient data. So we have a lot of restriction about that. We are not able to earn like profits of your work. So there's a lot of restrictions that keep our purpose in our direction. And it's working very well because in Brazil, we have a mixed health system. So 1/3 of our health system is private and 2/3 is public. So with this balance, we are able to, from each hospital that we have private, we are able to give for 2 hospitals for free. And as far we are a scalable solution that run in the cloud, we are able to give for free for them. So this is another thing that allowed us to do that, because scale a startup is very easy.
Have you been approached by other countries who are interested?
Yes. We already do some demos for Argentina, Colombia, Peru, Ecuador, United States, Portugal, and Spain.
Sorry, did you say United States?
Yeah, in the United States, we already do some demos.
The United States invited you? That's fantastic.
Yeah, because our tool, our system is very unique worldwide, because there is no other tool for clinical pharmacists, like specialized for clinical pharmacists. Most of the tools was designed and built for physicians. And the clinical pharmacists, nutrition, nurses have no tool to understand about a patient and to AI techniques, you know. So this is a pretty unique tool. You can search, you're not going to find no tool for clinical pharmacy.
That's really something. Congratulations on
Thank you.
such
Thank you so much, Jane.
an amazing creation. How do you see the future of No Harm?
We nowadays are mainly focused to help Brazil because to go in other countries, you need to spend a lot of effort, a lot of time and money to open to new markets. We need partners to do that, but we are not find no partner in US, not find partners in Mexico, in Colombia, in Europe yet. So when we find some partners, we are very willing to expand our business to other countries. But nowadays, we are very focused as a nonprofit to solve Brazilian problems, and we are scaling very well here. We are in traction. Every year, we grow twice in the numbers of patients, in the number of hospitals, in the number of revenue. So we are doing very well here, and we don't want to lose focus in Brazil at this point.
It might be too early, it might be too risky to expand.
Partners like Gates Foundation can help us to reach Africa, an example, but we still need partners in Africa to deploy No Harm in Africa hospitals.
Yes, well, my instinctive feeling is that you will find partners.
Yeah, my feeling too, for sure. I believe so, that we are going to find partners that understand our purpose, understand our delivery solution, how we can improve the overall quality of the healthcare system in other countries. And I also believe that we're going to find partners that will be willing to deploy No Harm in other countries and impact other lives than Brazil. For sure, we believe so.
How many years ago did you start No Harm?
We started in the beginning of pandemic in March of 2020.
Really? So it's not been that long.
No, 5 years, yeah. But it helped us a lot because everything we do is remote. So we don't have an office. We don't do demos inside. Everything we do is online, remote. And this helps us a lot to keep our budget low. So it helps us a lot. Because in Brazil, most hospitals did not do some demos and capacitation of the team remote, but during pandemic they was obligated. It's mandatory, so it helped us a lot.
I see. Yes, in fact, you're a very modern. I don't want to say company, organization. You're a very modern organization.
We are. We do AI, data-driven solution, and also remote.
Yeah. How do you see yourself personally evolving? If I may ask such a personal question, say over the next 5 or 10 years.
Yeah, I think one of the main and important skills that I should have and should learn more is how to manage a bigger team. Manage people are a very challenging task for a CEO or a manager. So I think I should understand better about how to manage a bigger team because we still small right now. We have 20 people. And also, I think we should improve our skills about getting fund from donators and companies and like wealth families and rich companies that we still not did that yet. We got some funds from Gates Foundation, but here in Brazil, we have other philanthropic people and companies that we are able to reach, and we need to learn how to reach them to improve our outcomes.
Oh, that's very interesting. You see yourself continuing in the same direction that you're going now, but expanding and maybe going higher in the organization.
For sure.
By higher, I mean taking a leadership position of a larger group of people.
Yeah.
And if you have distributed people in different parts of Brazil, that will take special leadership skills also.
Yeah. I think we are doing well right now, but I think we got more challenged when we increase our team size.
Yeah. Overall, sort of beyond No Harm, do you feel positive about the future of the world, the way things are going? And I don't mean just AI, I mean governments, countries, and technology. What do you think?
I think we have a very challenging world to live, a very challenging governments to run. But as I'm in No Harm, in a non-profit organization, I still believe that we can do some good with our tiny possibilities as a person, as a people, or a group, or a small company. We will still can make some benefits in our society in Brazil and all around the world. It's a challenge, but it's the world that we live. We need to face this reality. The reality is that we have a challenging world. So what we are going to do with that? Well, we choose to do good and to improve the others' daily lives, the healthcare system, because it keeps us in a better mood, when we do good for the people.
In this conversation, I have a feeling that I've had when talking to other people and reading in general. I think the young generation growing up now may be more likely to do things in the direction that you're talking about.
Yeah.
Do you have a feeling about that?
Yeah, I believe
I mean,
so.
young people who are 10, 12 years old, 15 years old, I think they will, from what people tell me, they are concerned about the future at a much earlier age than, say, I was, for example. I don't know what your age is, but I don't know how soon you became concerned about the future of healthcare, for example.
Yeah.
Do you think young people will be more likely to move in that direction?
I believe we have a new generation that are able to understand better the challenges of the world and how to manage it and to find solutions for that, to be less prejudiced, to be more conscious about the nature, the environment, the animals. So I think we still have challenges. We still have people that do not concern about others. We have these kind of people, but we also have a young generation that's come to bring benefits to the world, to in change this reality. With the challenge that we have, they will change our reality.
Well, I'm glad you feel that way. I think that's a good sign.
Yeah, thanks.
Are there any other things that you would like to say or messages that you would like to communicate?
Yeah, sure. I am a computer scientist, and we have this big wave and hype about AI. And I think No Harm brings to the world very fresh and new insights of how to use and how to deploy AI. So No Harm develop AI, but we do that as an open source company. Everything we do is open source because we believe that open source can spread the word and spread the benefits of AI. Also, we deploy in poor environments for free. So it's our equitable AI. And also, we are very concerned on where and how this AI is going to be used. So we never deploy AI in a healthcare environment without a support decision system. We always do that as a support decision system. AI never are able to make the final decision. AI should be in the healthcare system as a decision support system. So I think our ways to deploy AI, to develop AI, to deliver AI are fresh and new that people could be motivated to do the same and understand the benefits to do that, So as a computer science, this is what I want to give to the people. So do a equitable AI and a better AI for the world.
So can I tell anyone who contacts me and wants to get in touch with you, can I give them your email?
Yeah, for sure. We're very willing. We do partnership all around the world. We do partnership with everyone that reach us. We always like to understand more how we can benefit the other society and other peoples with our knowledge. So we are very willing to do partnerships. So anyone that hear this podcast, reach us by our email. That is someone somewhere here.
Great. Well, thank you very much, Henrique. This has been for me, a very enlightening conversation.
Thank you, Jane. Thank you for the opportunity to spread the word about No Harm and AI.
Well, you certainly deserve having the word spread far and wide.
Thank you. Thank you so much.